Watson's theory of transpersonal caring. Who is Watson? Margaret Jean Harmon Watson was born on June 10, 1940, in a small town in West Virginia. She was the youngest of 8 children and is surrounded by an extended family environment. She attended high school in West Virginia and the Louis Gale School of Nursing in Roanoke, Virginia. In 1961, she married Douglas Watson and moved to Boulder, Colorado. She has 2 grown daughters, namely Jennifer and Julie, and 5 grandchildren. She continued her nursing education at the University of Colorado. In the year 1964, she had her baccalaureate degree in nursing. In 1966, her master's degree in psychiatric mental health nursing. And in the year 1973, she had her doctorate in educational psychology and counseling. She then joined the School of Nursing faculty at the University of Colorado Health Sciences Center and served both faculty and administrative positions. In 1978 to 1981, she was the coordinator and director of the Nursing PhD program. In 1981 to 1982, she pursued international sabbatical studies in New Zealand, Australia, India, Thailand, and Taiwan. In 1983 to 1990, she was the dean of the University of Colorado School of Nursing and the associate director of nursing practice at the University Hospital. In 1992, she was honored as a distinguished professor by the University of Colorado School of Nursing. In 1993, she received the National League for Nursing Martha E. Rogers Award. In 1993 to 1996, she served on the Executive Committee and Governing Board for the NLN. In 1995 to 1996, she served as President for the NLN. And in 1997, NLN awarded her with an honorary Lifetime Holistic Nurse Certificate. In 1998, New York University distinguished her as a nurse scholar. In 1999, she received the Fetzer Institute's National Norman Cousins Award in recognition for her commitment and assumed the Murchison Scoville Endowed Chair of Caring Science at the University of Colorado. In 2005, she took a sabbatical for a walking pilgrimage in the Spanish El Camino. She received 13 honorary degrees from 9 international universities, from Göteborg University in Sweden, from Luton University in London, from University of Montreal in Quebec, Canada. In 2015 to 2016, she received an honorary doctorate from Erciyes University in Kayseri, Turkey. She was honored with the United Nations via the Nightingale Global Health Initiative 60th Session on Commission of Women, and an honorary of Chair Emerita of the International Society for Caring and Peace in Japan. According to the theory of transpersonal caring, nursing is concerned with promoting health, preventing illness, caring for the sick, and restoring health. It focuses on the health promotion and treatment of diseases, and according to Watson, caring is important in nursing practice and it promotes health better than a simple medical care. Assumptions of the theory. Caring as a center of nursing can be effectively demonstrated and practiced only interpersonally. Caring consists of curative factors that result in the satisfaction of certain human needs. Effective caring promotes health and individual or family growth. Caring responses accept the patient as he or she is now, as well as what he or she may become. A caring environment is one that offers the development of potential while allowing the patient to choose the best action for him or herself at a given point in time. 10 Caritas process. First, cultivating the practice of loving kindness and equanimity towards self and others is foundational to Caritas consciousness. Second, being authentically present. enabling, sustaining, and honoring the faith, hope, and deep belief system as the inner subjective word of self or other. Third, cultivation of one's own spiritual practices and transpersonal self, going beyond the ego self. Fourth, developing and sustaining a helping, trust, caring relationship. And fifth, being present to and supportive of the expression of positive and negative feelings. Sixth, creative use of self and all ways of knowing is part of the caring process. Engage in the artistry of Caritas nursing. Seventh, engage in genuine teaching learning experience that attends to unity of being and subjective meaning, attempting to stay within the other's frame of reference. Eighth, creating a healing environment at all levels. Ninth, administering sacred nursing acts of caring, healing, by tending to basic human needs. And lastly, 10th, opening and attending to spiritual or mysterious and existential unknowns of life and death. The meta paradigm of the theory. First, nursing. According to Watson in 1988, the word nurse is both a noun and a verb. Nursing consists of knowledge, thought, values, philosophy, commitment, and action with some degree of passion. Watson's theory calls nurses to go beyond procedures, tasks, and techniques in practice. According to Watson, humans cannot be treated as objects. They cannot be separated from self, other, nature, and the larger universe. The next meta-paradigm of the theory is person or human being. The person is a unity of mind, body, spirit, and nature. According to Watson, personhood is tied to notions that one's soul possesses a body that is not confined by objective time and space. The next meta-paradigm of the theory is health. Health is the unity and harmony within the mind, body, and soul, associated with the degree of congruence between the self as perceived and the self as experienced. According to Watson in 1988, while illness can lead to disease, illness and health are a phenomenon that is not necessarily viewed on a continuum. Disease processes can also result from genetic, constitutional vulnerabilities and manifest themselves when disharmony is present. Disease in turn creates more disharmony. And lastly, environment. According to Watson, the role of the nurse in the environment is to attend to supportive, protective, and/or corrective mental, physical, societal, and spiritual environments. She said in 2013 that healing spaces can be used to help others transcend illness, pain, and suffering. When the nurse enters the patient's room, a magnetic field of expectation is created.